Hey, how are you? Today I'm gonna present the pharmacology presentation that included the 26 drugs. And first one we got here, tumbrimacine. The class of it, it's antibiotics. The dose from 4 to 7 milligram kilo a day. Usage prevent bacteria and infection. Second one we have is Spiriva. Spiriva, the class is anticholinergics. The dose is 1.25 mcg. The treat for it, like the usage, treat COPD. In the EpiPen. The EpiPen, the class of it, it's alpha and beta adrenergic agonists. The dose 1 milliliter. The usage treat a serious allergic reaction to either insect stings or bites. Macomest, its class pulmonary or acetylcysteine. The dose of it is 3 to 5 milligram of 20% solution or 6 to 10 milliliter of 10% of solution 3 to 4 times a day. Usage helps thin and loosen mucus in their airway due to certain lung disease. Flovin. Flovin, the class is corticosteroids inhalants. The dose is aged from like 4 years old to 88 mcg. Is two inhalation of 44 mcg, 12 hours apart. Usage treat asthma patient of 4 years and older. Pentamidine, the class of it, it's antiprotozoals. Dose 300 milligram solution. Usage treat pneumonia caused by fungus. Prednisone, the class corticosteroids. The dose is 5 milligram to 60 milligram per day. Usage relief swelling, redness, itching, and allergic reaction. Ribavirin, the class it's nucleoside analogous. The dose is 800 milligram per day in two divided doses. Usage treat patients who has hepatitis C. The Bilmozyme. The Bilmozyme, the classification of it, it's enzyme, and the dose is 2.5 milligram single use and pure inhaled once daily using the jet nebulizer. Usage treat patient with cystic fibrosis. Albuterol, the classification, it's bronchodilator. The dose of this medication will be used different on different patient, like from different to different patient of the using. And usage prevent and treat difficulty breathing or wheezing. Amphotericin B, the class antifungus. Dose 50 milligram per vial, and the usage treats serious and potentially life-threatening fungal infection. Symbicort. The classification of it is corticosteroids. The dose medium to high 160 over 4.5 mcg and 2 inhalation. Usage to prevent wheezing and shortness of breath that caused by asthma or ongoing lung disease. Theophylline. The class is xanthines. Dose for adults 600 milligram per day as needed. Usage prevent and treat wheezing, shortness of breath, and chest tightness caused by chronic bronchitis, and other lung disease. Advair. Advair, the class is steroids. The dose is fluticasone, propionate, 45 UG, and silmeterol, xanavoate, 21 UG. The usage prevent and treat wheezing, shortness of breath, coughing, and chest tightness caused by chronic obstructive pulmonary disease. Racemic epinephrine, class non-selective alpha and beta adren- adrenergic receptor agonist. Dose 0.5 milligram solution every 3 to 4 hours. Usage is temporary relief of symptoms associated with bronchial asthma. Brovana. Brovana, the class is LABA. Dose is 15 mcg unit dose vial. Treat COPD. DUO NEP, the class is respiratory inhalant combos. The dose 3 milliliter vial 4 times a day. And the usage for it is airway narrowing. Servant, the classification is beta agonist. The dose is 42 mcg twice daily. The usage prevent asthma attacks. Fluticasone, classification is corticosteroids. The dosage is 50 mcg 2 sprays. And the usage relieves seasonal and year-round allergic and non-allergic nasal symptoms. Xanax, the classification of it corticosteroid. The dosage 100 to 200 mcg. The usage prevent asthma attack and control asthma symptoms. Uh, Colimicine. Colimicine is class antibiotics steroid surfactant. The dosage for it is 2.5 to 5 milligram per day. The usage treatment acute infection to sensitive strains. Levodopa. The class is beta agonist and the dose is aerosol 90 mcg. Usage relief wheezing, shortness of breath, and coughing. Xolair is the classification is monoclonal antibodies and anti-asthmatics. The dose is 75 to 375 mg by injection. Usage moderate to severe persistent asthma. Pulmicort is classification for it corticosteroids. The dosage is 0.5 mg once daily. The usage prevent asthma attacks. Hypertonic saline. The classification mucolytics and the dosage is 3% dose injection. And the usage treats symptoms of electrolyte and fluid repletion.